We're the Care Quality Commission, and since April 2009 we've been the independent regulator of health and social care for England. And what that means is we're responsible for setting standards of quality and safety for health and social care services, and then making judgments about how good those services are at meeting those standards. The other thing we do is comment on the quality of commissioning, which is how good adult social care and primary care trusts are at purchasing services, high quality services on behalf of their populations. In December, we're publishing 3 reports. First of all, the annual performance assessment of councils, which looks at how good adult social care departments are at arranging social care services for people who need them in their areas. The second thing we're doing is we're looking at the quality of commissioning. So we're looking at how good local authorities have been at commissioning high quality care for people as judged by the ratings of care providers in their particular locality. And then the third thing that we're doing is we're publishing an assessment of whether or not the quality of care in domiciliary care providers and in care homes is improving. And that's based on the work of our inspectors judging the ratings of services over the last 12 months. And what the results are showing is a much more positive picture across adult social care. We've seen an improvement of the ratings of the councils, so 95% of councils are now being rated as performing well or performing excellently in terms of the quality of services that they're procuring for people in their areas. So that's an improvement from 87% this time last year. And in terms of the ratings of the homes, again, we're seeing a trend of improvement in quality. In terms of the percentage of homes, 77% of homes are now rated as being good or excellent, as opposed to 69% this time last year. So both in terms of how local authorities are commissioning services and the outcomes that that's achieving for their local populations, and in terms of the quality of care we're seeing in homes and in domiciliary care providers, both of those are improving. That means that over 28,000 places that local authorities bought in care homes, that's 3/4 of all the places that local authorities bought in care homes, they were in homes that were rated either good or excellent. And of course that makes an enormous impact on the quality of care that people receive. Next year, a new registration system comes into place for adult social care providers. So by October 2010, they'll have to register themselves against a whole new set of quality standards. That gives us an opportunity to look at all adult social care providers, but particularly to focus on those providers that are still regarded as poor or those that are regarded as adequate. So we'll be looking at those poorer performing organisations and saying to them, what do they need to do now in order to make sure that they meet these new quality standards that are contained within the new registration system. So we'll be working with those homes, and we'll be working with the local authorities in which those homes are located to make sure that the standards of care that are being provided by those care homes or by those agencies are good enough for the people who are using them. The other thing that we'll be doing is talking with local authorities about how they can work to improve the quality of care in their areas. So, for example, by providing training courses for local care providers or other activities that they can do in order to ensure that the care in their area is as good as it needs to be for these often very vulnerable people.